If you are over 70 and your doctor recently celebrated getting your blood pressure down to 120 over 80, you need to hear what I am about to tell you. Because a major study published in the Journal of the American Medical Association tracked over 15,000 seniors for 5 years, and what they found contradicts nearly everything we have been told about blood pressure targets for older adults. The seniors with so-called perfect blood pressure had a 28% higher risk of serious falls, and their overall mortality rates were actually worse than those with moderately higher numbers. I know that sounds impossible. We have all been told for decades that lower blood pressure is always better. Get that number down to 120 over 80 and you are golden. But the research is now showing us that for people over 75, that target may not just be unnecessary, it may actually be dangerous. Let me paint a picture that plays out in doctor offices across the country every single day. A 78-year-old comes in for a checkup. Blood pressure reads 145 over 86. The doctor pulls up the standard guidelines, sees the recommended target of less than a 130 systolic, and starts adjusting medications. One drug is increased, another is added. Over the next few months, that blood pressure comes down beautifully. 124 over 78. The doctor is pleased, the numbers look textbook perfect. But here's what the guidelines do not account for. That same 78-year-old now stands up to go to the bathroom at night, and their blood pressure drops from 124 down to 88 over 56 within seconds. Their brain is suddenly not getting enough blood. The room spins, they reach for the wall but miss. And suddenly we are not talking about blood pressure numbers anymore. We are talking about a fractured hip, emergency surgery, 3 weeks in rehabilitation, and a cascade of complications that too often ends in permanent loss of independence. My name is Dr. Michael Williams, and blood pressure management in seniors is a topic I feel strongly about because I have watched this exact scenario unfold with patients too many times. The gap between what the latest research shows and what is happening in everyday medical practice is costing seniors their mobility, their independence, and in some cases, their lives. Here is the part that sounds counterintuitive, and I need you to stay with me. For decades, the mantra has been simple. Lower blood pressure equals better outcomes. And for middle-aged adults in their 40s and 50s, that is largely true. Getting blood pressure under control in midlife genuinely prevents heart attacks, strokes, and kidney disease. The evidence is solid, but something fundamental changes after age 75. Multiple large studies now show that seniors with systolic blood pressure between 130 and 145 actually live longer than those whose pressure is pushed below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120 over 80 had higher rates of dizziness, fainting, acute kidney injury, and yes, higher mortality rates. To understand why, you need to know 3 things that change in your cardiovascular system as you age. First, your arteries become stiffer. A young artery is flexible and elastic, expanding and contracting with each heartbeat to smooth out blood flow. An older artery is more like a rigid pipe. It cannot expand to absorb the pressure wave from each heartbeat, which means you need slightly higher baseline pressure just to push blood effectively to your brain and kidneys, especially when you're standing upright and blood has to flow against gravity. Second, the sensors that regulate your blood pressure in real time become less responsive. These sensors, called baroreceptors, detect pressure changes and instantly signal your brain to compensate. In a young person, they respond within milliseconds when you stand up, but these sensors become sluggish with age. So, if your resting blood pressure is already low from aggressive medication and your baroreceptors are slow to respond, you get a dangerous drop in pressure every time you stand. This is called orthostatic hypotension, and it is one of the leading causes of falls in seniors. Third, your kidneys and liver do not process medications as efficiently at 75 as they did at 45. A dose of blood pressure medication that was appropriate for a middle-aged adult can be excessive for an older person. The drug lingers longer, has stronger effects, and can push blood pressure dangerously low, particularly during sleep and upon waking. Now let me share a test that could genuinely protect your life, and most doctors are not performing it routinely. It is called an orthostatic blood pressure measurement, and you can do it at home tonight with a basic blood pressure monitor. Here is the protocol. Lie down flat for 5 minutes. Rest completely. After 5 minutes, check your blood pressure while still lying down and write down both numbers. Now stand up and immediately check your blood pressure again while standing. Compare the two readings. If your systolic pressure dropped by more than 20 points, or your diastolic dropped by more than 10 points, you have orthostatic hypotension. This means your blood pressure medications may be too strong, or your blood pressure target may be too low for your physiology. Even if your sitting or lying blood pressure looks perfect by conventional standards, if it drops that dramatically when you stand, you are at significantly increased risk for a fall every time you get out of a chair, get out of bed, or stand up from the dinner table. So what should your blood pressure actually be? Based on the most current research, here's what the evidence suggests for different age groups. Though I want to emphasize that your individual target should be determined with your doctor based on your complete health picture. For healthy, active adults aged 65 to 74, a systolic range of 130 to 140 appears to be reasonable, providing cardiovascular protection while maintaining adequate blood flow to the brain and organs. For adults aged 75 to 84 who are relatively healthy, the evidence supports a systolic range of 137 to 145, higher than the younger group to account for arterial stiffness and slower baroreceptor responses. For adults over 85 or for those who are frail regardless of age, a systolic range of 140 to 150 may be most appropriate, where preventing falls and maintaining quality of life takes priority over aggressive blood pressure lowering. For diastolic pressure, the bottom number, doctors say it should generally stay above 65 in older adults, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during its relaxation phase and can cause problems of its own. If your diastolic is consistently below 60, that is worth discussing with your doctor, even if your systolic looks fine. Here are the specific steps I want you to take. First, purchase a home blood pressure monitor if you do not already have one. Check your pressure at the same times each day, morning and evening, for 2 weeks. Keep a written log. This gives you a much more accurate picture of your true average pressure than occasional office readings. Second, perform the orthostatic blood pressure test I described. If you find a significant drop, document it and bring it to your next appointment. Third, assess your symptoms honestly. Dizziness when standing, unexplained fatigue, difficulty concentrating, these might be signs your pressure is being pushed too low. Fourth, schedule a specific appointment to discuss your blood pressure targets. Do not just accept a blanket statement about needing to be at 120 over 80. Ask what target is appropriate for your age, your other medical conditions, and your functional status. You might wonder why your doctor has not mentioned any of this. The answer is that medical practice changes slowly. The trials that established 120 over 80 as the ideal target were conducted primarily in middle-aged adults, and those results were applied broadly across all age groups. It has taken years for researchers to study older populations specifically, and even longer for those findings to filter into clinical guidelines and everyday practice. I want to close with this. Your blood pressure number is important, but it is not the only thing that matters. Your stability when you stand up matters. Your cognitive clarity matters. Your ability to exercise and stay active matters. Your risk of a devastating fall matters. A blood pressure reading of 138 over 82 in a healthy, active 78-year-old who never feels dizzy and walks every day may be far safer than a reading of 118 over 72 in the same person who now feels lightheaded every time they stand, treating the patient, not the number. That is what modern, evidence-based medicine looks like. If this video changed how you think about your blood pressure, please subscribe. I share new content every week to help seniors navigate their health with confidence. And if you know someone over 70 whose doctor has been aggressively targeting 120 over 80, please share this video with them. It could prevent a fall that changes everything. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of yourselves.